Good afternoon, everyone. It's an honor to be here to present this initiative. My name is Kehinde Ogunyemi. I'm from Emory University, and today I'll be presenting this title. So lots of this, things that have been said by Professor Maria, Prof. Rodrigo, and other ones kind of touch on what I'll be saying today. I think I moved from the point of confusion to the point of innovation or sort of adaptability to be able to come up with something like this. And so this is not me alone. So there will be some acronyms that will be repeated in this presentation, which we're already familiar with. So I have a team behind me, which majorly works across the global security space. That's me, the first person there. Those are the core area of expertise, growing expertise for me. And we have professors and the likes of other leaders who actually are from low and middle income countries, and they are actually policymakers, because it was very important to ensure that this collaboration is, bidirectional, is, co-creation, to co-implement and also co-design. So we have we have the range of 10 to 30 years uh, evidence-based implementation, evidence-based intervention implementation. I have the least experience, which is 10 years, and Professor Scott McNabb has the most experience. I've actually worked on this potato side, not directly to say I'm an implementation scientist, but having been on the medical background, having been part of it directly and indirectly, I do have some sufficient knowledge that I can think can contribute to knowledge. So what's the rationale for this initiative? So this idea actually came from the need to generate new insights towards evidence-based practice gap reduction, which has been said by majority of the speakers. And of course, we have these two extremes, and we would like to focus on the low and middle income countries because that's where the burden is greatest. But at the same time, it also offers opportunities, for rapid scale up, because they do have a centralized sort of formal healthcare system. So when that is existing and policies, window of opportunity that are available, then there's opportunity for, for adaptation and for scale up. So this initiative is focusing on pre-implementation, which I think is very important, or is a good precursor to sustainability. Because if the pre-implementation outcomes is not well taken care of in terms of effectiveness and other things, then that's might likely just deter the effort towards sustainability. And we have 3 E conundrums, and that talks about having the evidence-based intervention as the foundation at base. Then we move towards the short-term goal of effectiveness, and how we also think about efficiency and think about equity. And that has been said by a majority of the speakers today. So that's the goal. And what is exactly the gap here? So the gap in the conventional tools and methodologies are pretty clear. Looking from the science perspective, we know that there's complexity of contextual fit and visibility outcomes. And that's also very important to think about how we have so much multidimensional interactions and influences of contextual factors. And in terms of the constructs that they also define the outcomes. Again, we also have the issue of incompleteness of data on this outcome, contextual fit and visibility itself. Again, that's also can be explained by the subjective assessment. A researcher just decides and says, I'm going to use this construct to measure contextual fit. I'm going to use this construct to measure visibility. There's that lack of harmonization, so it's just subjective. There's no standard, for doing that. So, and it creates chaos, it creates confusion. It even limits us being able to, compare, studies across settings or across, EBIs. So again, looking at the practice perspective, the issue, speaking from policy making angle, is the lack of pragmatism. I have seen it for a number of years, long period of sub-implementation, under-implementation, de-implementation, because most of the frameworks, most of the theory are not that, practical for policymakers, even for implementing site practitioners. So the idea is there's a need to, develop something that is more practical and more usable. And I think Prof. Maria touched on that and other speakers. So the aim and objectives of this initiative, like I said earlier, the first, angle is to generate new understanding, on how we can measure contextual fit and visibility. And based on this predefined or pre-established, evidence to practice gaps, again, to now use that to create a novel tool that can be used to actually measure these outcomes in a real-world setting. Then, of course, to do that, we need a transdisciplinary approach. We need to go beyond just multisectorial or perhaps interdisciplinary. We need to, involve, different people, be more practical in the approach. That's why policymakers were reached out to in the first instance, and they were kind of multidisciplinary, and they have expertise across so many areas. So we defined the strategy, we conducted the activities, and we also disseminate, which is one of the things I'm doing right now. I'm trying to disseminate, the knowledge behind this. Then again, the last thing will be, but not the least, will be to ensure we have access to the tool and also continue to build capacity for the tool. So what's the principle? To do something pragmatic, it is to also ensure that there are some guiding principles, right? So we set out to define what the principle will be and what will be the goal and perhaps what will be the aim of the tool itself. So for the principle, it's strictly equity. That's the issue. The issue is we need to drive equity, very quickly, very rapidly. Then again, the goal is to develop a multi-user policy responsive tool. Like I said, policymakers are not able to make use of the implementation frameworks, the theories as they should. So we actually want to make it more responsive. Then the aims is to have an integrated tool. By that, I mean, usually in practice, what we see is people or researchers just, measure contextual fit at one point and measure visibility at one point. So sometimes with different timeline, different tools, but I think it's more useful when we think it's more useful when these are done, concurrently, and the findings are available and can be analyzed concurrently and to make informed decisions, right? Again, to also ensure statistically powered, tool and methodology such that we have it more representative and it's kind of generalizable. Again, real-world decision support, trade-off is key. Policymakers make trade-off. So do we have this tool? Are there any tools that currently exist that allows us to make trade-off? So that's what we're trying to achieve with this, initiative. Then again, how does this tool help us to actually guide or inform scale-up? And that also informed the strategy that we also put in place to scale up. So we identify 5, steps to actually achieve this. For me and for the team, we felt stakeholder engagement is good, but may not be good enough. So we believe in stakeholder envisioning, which means even before you engage, right, you need to identify who are the key partners, right? So if we're trying to do something for the LMICs, like this tool we mostly use in LMICs, it was very important to ensure that they are fully represented in the tool development. We envisioned this tool together. We didn't do it from Emory University or from Moore School of Arts and Medicine and say, okay, come. So it was envisioning coming together as a collective and matching our aspirations, matching our motivations, and building the consensus and moving towards a common goal. That was what we did. So, like I said, it's multi-sectorial, it's multi-level because these people you saw as the key members, they are directors of key agencies, and you can check them out. They have expertise across many implementation. And so they've operated at local level, at state level, subnational level. So they bring all this expertise, on board. And again, we had iterative deliberations on what we needed to do. We then moved to the next step, which is evidence synthesis. So just working a little step, just working backward because there's confusion, like I said. We were confused from the onset. So it was just trying to understand, can we better even understand what is contextual fit? What is visibility? And again, to do that, there's a need to actually know what the current state of knowledge, was. So we did we triangulate evidence from articles, expert opinions, great literature. We searched, a curated platform for implementation science tool, which you'll see from the discussion goes on. And we use the implementation outcome repository. It's, has a good list of curated tools. We also did Embase, and we used Google search to also, advance this knowledge. Then we did what we call a step 3, evidence deconstruction. So we did what we call literary analysis to actually identify semantics and syntactics of what we know. And I will discuss that as we, progress. Then we're able to define and identify what the construct should be, because there were so many constructs that have been used by different people. Again, we also had a consensus. We had to agree as a team. And then we endorsed, and after endorsement, we actually designed it to form the questionnaire and we operationalized it. And the goal will be eventually to access the pragmatic and the psychometric properties of this tool, and also to continue to use, feedbacks from practitioners to refine the tool. So just a snippet of what we did in terms of evidence deconstruction. So again, like I said, we start out to identify the synthetics and the semantics of the definition and the theoretical assumption of what the definition has been. Many people have defined contextual fits in so many ways, but we found 2 key definitions very important. The one by the National Implementation Research Network and the one by Holland and colleagues. So, but we chose the one from the National Implementation Research Network because it's very comprehensive. And what we did was we worked back. For this, for example, how well the program or practice aligns with implementing site and focus population. How do we interpret it? So we as a policymaker, we as a researcher, try to, interpret it in a new way, a new understanding. And we felt this actually speaks to intervention appropriateness and population acceptability. But again, you see us underlying acceptability. Why? Because for you to accept something, you must have accepted it based on appropriateness. But again, for you to also make something appropriate, to choose something that's appropriate, it will be informed by the characteristics of that intervention. So we were focused on the endpoint, and the endpoint was acceptability. So that's how we chose acceptability as a stable construct for one of the stable constructs for contextual fit. So the same process also for this one. This phrase here, perception of strength, needs, values, history, and other initiatives, we interpreted that as needs, structural, sociocultural environment, and preference. And we also felt it was very important to choose the endpoint, which was preference. So we did the same thing also for visibility. Then again, we also try to triangulate knowledge to action framework with unified theory of acceptance to be able to see how other determinants interact to inform the implementation outcome. Then this new knowledge was synthesized into how we can better define contextual fit and visibility. Then again, we also demonstrated the advantages or the potential of this new tool versus conventional tools. Then this is the questionnaire. And we also try to do a rating system whereby we talked about the interaction of the construct. This time around, we're not using summative scoring. We are looking at the interactions of how the construct in the real world will play out. We have the high, low, and how that can actually inform the ratings of the tool. Then the results were kind of, we looked at it from the population level, and we have strategies to see how we can ensure it is representative. And we have also developed case studies to show how this tool can be applied at the policy level. And you see questions and how it can be interpreted. And we also recognize some limitations of the tool and potential implications like you can see here. And the next steps will be to actually develop, to test substantive validity, interpretive validity, and make the tool more useful And eventually, we see this as a step in the right direction to actually contribute to optimizing the adaptation and scale up of evidence-based intervention. Thank you.